Welcome to Focus on Albany. I'm Cynthia Pooler. My guest today is Mary Rozak, and Mary is going to talk about the uptick in COVID cases in Albany County. So, Mary, it looks like it's rearing its ugly head again.
It is rearing its ugly head. It never really, it never went away, Cynthia, and that's part of the problem, right? So, um, we have been living this since early 2020, and I
Right.
know people are tired. People are worn out. People have just said, thrown their hands up in the air and said, "I'm done." And yet at the same time we know that COVID still isn't over. And so
Mhm.
the people that are saying that they're done, it's going to be here forever, and what are we doing, and why are we doing this? There are some very important things we need to remember. If you remember back when COVID first hit in 2020,
Mhm.
we knew nothing, right? We knew
Right.
that we knew that there were people that were sick in China, that were sick in Europe, and it slowly
Mhm.
was making its way here. We
Right.
knew that people were sick and dying,
Mhm.
and we really knew not a whole lot else, right? So
Right.
fast forward now to May 2nd
Mhm.
of 2022. So
Mhm.
early May, we know a whole lot more than we did. So if we think about the last, 2+ years, we knew that washing our hands frequently, coughing and sneezing into our elbow, keeping some social distance, wearing a mask, we knew
Mhm.
that those things were helpful in stopping the spread. We
Mhm.
then found out and got to the point where there was a vaccine that was
Right.
created to help us with that protection.
Mhm.
And so at that point, people were doubling down. They were getting their shots. And I say doubling down, some one with J&J, some two with Moderna
Mhm.
and with Pfizer. And they were getting their shots, getting their full series. And still, they were masking and following the good hand hygiene practices because that was still keeping the spread kind of in a holding pattern, right?
Mhm.
Until we said we would get enough people vaccinated. But we've learned with the way that this virus has continued to morph that there are variants, and some variants are much more contagious than others.
Mhm.
And so what has happened is we have, practiced all of the mask wearing things. And then we said, you know what, we can take our masks off. Well, that may be fine, except when a new variant comes along that may and could very well get some people very sick.
Mhm.
Putting a mask on or keeping it on in areas where you're in a public place that's indoors, or you're with people that may not have been boosted or gotten their shots. Um, those who are vulnerable, we know that that is best to do that.
Mhm.
And so now we have, another booster, right? We had the initial vaccine, then we had a booster, now we have another booster.
Mhm.
So, I wear my mask. I'm in my office now by myself, but my mask is on whenever I am in a public space. My mask is on when I leave my office. My mask is on even, today we had a couple of public events, and one was indoors. I was one of only a handful of people that were masked, and
Mhm.
that's okay, right? I have my mask on to protect myself and to protect my family.
Mhm.
And if others feel safe, that's perfectly fine. I also need to stress that people should not pass judgment on those who want to wear a mask. And I don't just say that because I'm wearing one, but I foresee at some point when this becomes when COVID-19 becomes endemic, what they say is going to happen when there's no longer a pandemic, but will continue to happen almost like the flu, perhaps even seasonally every year. Um, I fully intend in the high seasons to wear a mask. I
Mhm.
mean, I probably, should have been doing that over the course of what we think are very contagious times during the winter when
Mhm.
people are getting sick or had gotten sick more frequently in the past. Um, if I had done that, I probably wouldn't have caught a cold as frequently, or who knows how many people would not have gotten the flu.
Mhm.
The thing that we need to think about is while we have learned a lot over the last 2+ years, we have learned that these protections will help us prevent severe hospitalizations and prevent deaths. And that's what's important. People always ask when we look at the 500 and let me look, I think it's 551 Albany County residents that have passed from COVID-19. People always say, well, did they have underlying health conditions? I think I need to step back and say, look around. Every single person pretty much has an underlying health condition. And then the hands go up and say, well, the severity of it. You know, doctors talk about being overweight as a serious condition. And if you look at the population, Americans in general, most Americans are overweight.
Mm-hmm.
Many Americans are obese. So if you look at those classifications, medical classifications of overweight and obese, then a great majority of the population has an underlying health condition that is very serious, because
Right.
people don't think of weight as being something that's very serious, but a doctor will tell you it impacts your blood pressure, it impacts how your heart works, it impacts all of your organs to one degree or another that make it a serious underlying health condition. So
So, so let me ask you this. Has there been an increase in hospitalizations because of the new variant?
we've had a little bit of an ebb and flow, and so it's a snapshot in time. When the county executive reported last week, we had one of the highest rates of hospitalizations that we'd had since February, and so that becomes alarming. We had let me see, 42 people hospitalized on May 1st, and if I quickly can take a look historically, at hospitalizations. The last time we had in February, we had highs in the 50s and 60s and 70s and 80s and 90s and 100s. We had, this number when things started to ebb a little bit, in the 40s in December. Of December of 2021. But as I quickly look through the spreadsheets, when we were, in the early part of 2021, we were seeing that early part, like around February and March, and then we were seeing, of course, in January of 2021, the higher numbers in the hundreds. And when we were in the 40s previously in 2020, or towards the end of 2020, we were thinking, okay, those are great numbers. But when you actually take a look at where we have been, that's not so good. The difference is when you have 42 people in the hospital, the chances are, as I look at that snapshot in time, there was no one in the ICU.
Mhm.
People are not, they're being treated differently because we know more about the virus.
Mhm.
And so we're not seeing, like we did in the beginning, the throngs of people that were going into the hospital that would have to be on ventilators, and
Right.
that many times would not be able to get off the ventilator until they died.
Mhm.
And that's what would in many cases happened.
Mhm.
Um, we have seen recently, at least one of the area hospitals um, go back to stricter rules about visitation for people in the hospital.
Mhm.
You know, this is not something that you take lightly. But at the same time, you want to protect people. You want to make sure that you're not creating or being part of the creation of a circumstance when we might find, something that's widespread and extremely serious again.
Right.
So when we have people, Cynthia, you had a little cough right now. Remember
Yeah.
2 years ago, if you coughed, everyone that you were around you was like, oh my God, they were running for the door, right?
Right.
We're getting back to a place though where now people, if you're coughing, yeah, okay, what other symptoms do you have? The first thought, maybe, all right, I'm going to take a COVID test and double check, because we have so many at-home tests. You can take one and in 15 minutes,
Right.
and then you can move on to something else. But we are pretty regularly over the last several weeks seeing numbers of new positive cases in the hundreds and in the 200 plus numbers in the last week or so.
Mhm.
So you have to take it very seriously when
Mm.
people are getting the virus and then passing it along.
Now I remember Thanksgiving.
Hmm.
I felt kind of a little apprehensive about spending Thanksgiving with my friends, and because there were elderly people at
Hmm.
dinner. But then the day after Thanksgiving was the first time I heard of the Omicron
Hmm.
variant.
Yeah.
And at that point, they were saying, well, it's not as, you know, uh, deadly, or if deadly is the right word, as it has been in the past. But now it seems like the variant is creating more havoc with people than it was back in the at the end of November. So
Mhm.
can you explain that a little bit? Is this a subvariant of the variant, or?
Well, they're talking about subvariants of the variant, and you know that's what makes this always so dangerous. And I use the word dangerous because it's survival of the fittest, right? When it comes to germs, when it comes to how they transform themselves, you've got this nasty virus that is transforming itself so that it can still keep going, right? And here we
Right.
are a little step behind because we're trying to figure out what it's going to transform into, and we're
Mhm.
trying to protect people against that, which is scary. But I think that it continues. The virus continues to morph, and we've seen that happen again and again. I know that as we talk about the booster and people that are getting boosted, and then we're talking about a vaccination in the fall, and the discussion is about what will be in that new vaccine, and will that be a one and done per season, as opposed to what we're doing now. Is that what scientists are working on, taking into consideration what the variants have shown
Mhm.
us? Or is it going to be? I hesitate to use the word crap shoot, but is that what it's going to be? Just like some years the flu shot is more effective than others.
Mhm. Mhm.
So that's what we're looking at. I think that people have a very different understanding now of what COVID is and can do and is capable of. I think the fact that we have advised people, as the CDC, as we've always done, follow the science, and we look to the CDC as the
Mm.
guide. And the CDC says, you know what? If you're in a high risk area, such as we are here in much of upstate New York and in Albany County, it's prudent for you to put on a mask when you're going to be in an indoor space.
Mhm.
And who can argue? Who can actually argue with saying we are suggesting that this would be in your best interest?
Mhm.
How can you argue with that? We're not
Right.
saying do it. We're saying this
Mhm.
is the best advice we can give you. All we can do is give you advice in this instance, right?
Now I have a friend. Oh, we've been friends for 40 years, and he retired a little bit after I did. And he's recovering from a stroke,
Hmm.
so he does not go out much. And I spoke to him briefly the other day, and he said, well, I've got COVID. I said, how could you have COVID? You never go anyplace. He says, well, we go to the supermarket.
Yeah.
I mean, is it that contagious that you could get it just like not in a cramped social setting, but in a suit? Is it that contagious?
I mean, it's entirely possible. I'm not a doctor, but
Right.
and I didn't sleep at a Holiday Inn last night, right? So, as the old joke goes, but you know, a mask. I go into a store, I have the mask on. I still use the wipes when I'm encountering, the shopping cart. Um,
Mm-hmm.
I know that a lot of people are not wearing masks anymore, and I know that there are many people um, that I've seen that aren't coughing or sneezing into their elbows. They're, you know, reverting to some bad habits. And I've seen that in public places. And, people don't think about it. I was somewhere recently where um, I was out to dinner and there was a server and for a buffet style table. And I watched as the server did not have gloves on and proceeded to wipe by her nose like this several
Oh.
times. And, then kind of, it's they're the innocent things. I say innocent because people don't
Mm-hmm.
think of them like that.
Right.
but then go back to take a buffet tray out
Mhm.
of the sterno table, and then take the serving implement and, use a serving implement that she's touching. Now you think about that. That that doesn't necessarily have COVID written all over
Right.
it, but whatever
Right.
cold or flu or whatever that person had,
Mhm.
has now been transferred to those other surfaces.
Right.
So, I thought of that and I'm like, oh man, this is not a good thing for me to be looking
Mhm.
at.
Mhm.
Um, and at the same time, I don't think people think about those things. There are
Mhm.
a couple of other um, sicknesses that people have come down with. I know most recently people that I know, there are two different kinds of things that are not COVID related, but everything has similar symptoms.
Mhm.
So the first thing I said is, okay, well, did you do a COVID test? And so repeatedly over a series of days, um, in different instances, people would take COVID tests and it wasn't COVID.
Mhm.
So it was just kind of interesting that one was um, like kind of a head cold, nasty thing that
Right.
eventually went away. But I think some of it, people are talking about the fact that wearing masks, you may protect yourself from getting something, but you're also not getting those germs in there. So when you get it, maybe it's a little bit worse. I
Mhm.
don't know. But you hear all kinds of theories.
So I remember, and I think I told you this before. I remember back in March of 2020. It was just a few days before, you know, I had seen the county executive at an event in Colony that was on a Sunday. And
Hmm.
by Thursday, everything was closed
Sure.
down.
Yep.
When this first happened, did you anticipate the the severity of this?
I don't think anybody did.
Okay.
I really don't. I mean, you'd heard what was happening, across the pond, right?
Right.
So we knew what was happening, and we just didn't know the length of how it would happen. I mean, when I went in to have my nails done.
Mhm.
I remember getting them done it was just maybe about a week before the shutdown, before we knew everything would shut down.
Mhm.
And I remember talking to my manicurist and saying like this was serious. And I remember picking something similar to what I have now. I'll show a pale pink. And I remember picking a pale pink because I thought if something happens, you know, I'm not going to be able to get my nails done for a couple of weeks. I better have something I can blend. Well, three
Right.
months, 3 months.
Right.
And I had it on, and it was funny because I would joke and every so often send a picture to my manicurist and say, "Can you believe it? People don't even know that I haven't got my nail, but can you see the growth? Because I take
Right.
one of the few things that I take very good care of." And he would laugh and send me a text and say, "I know it's going to be soon." I said, "It better be," but I don't think we had that kind of vision. We didn't know that. I think that's what everyone's afraid of now. I think
Right.
people are afraid when there's a suggestion of putting on a mask. Again, for public health and public safety, I think they're thinking, all right, we're returning to a lockdown. We're returning to a shutdown. We're returning to something that we really didn't like and really don't want to have to go back to again.
Mhm.
That's not at all what's being said, but I
Right.
think that's people are gun shy about that.
Mhm.
And I don't think we can ever forget that. I think the one way to make sure that never happens again is when there are those suggestions, those slight warnings that, hey, you know what? You don't want to feel as sick as someone else did when they got it. Why don't you keep a mask on and just be careful? And maybe you won't get it, but here are some suggestions. I think people really need to pay attention to that. I mean, I know
Right.
you talked about the holidays, most recent holidays.
Right.
We had Passover and we had Easter,
Mhm.
and I know that a lot of people were getting together for the holidays, and I think that's
Right.
why we saw an increased number of cases. Now, I was pretty strict in what I said I would and wouldn't do,
Mhm.
and was a little nervous when there was going to be a gathering with 20 people, and the night before, we were told that someone who had shown up, a relative who had shown up wearing a mask and said he was wearing a mask because he kind of felt a little under the weather, um, earlier that day, they decided maybe you should do a COVID test, and he was COVID positive.
Hmm.
So at that point, when we're finding this out on that evening, and I said, I'm sorry, the message coming through was, well, we're all vaccinated, we're all boosted. He had a mask on the entire time. We're
Right.
all okay. I said, you know what? There are six of us that we don't live and breathe at the same air and the same environment there, and I
Right.
think it would not be a good idea. And we didn't gather. Um, Subsequently, no one else did get sick,
Mhm.
and of course we hadn't interacted. But I think it's a matter of making what I think are smart decisions.
Right.
And sometimes I think people are just, rather than take that extra second to say, is this really, do I really want to take that chance? Because what does that chance mean?
So when you took your mother to to what is now MVP Arena, it was the
Mhm.
Convenience Center for
Yep.
Michael Bublé,
Michael
wasn't
Bublé
it?
back in October, which was, how many birthdays ago had I given it to her as a present?
Right.
Yeah, it was interesting because at that point in time, we were in a little bit of a different place, right? We were in, we have the peaks and the valleys, and we were in the valley, and everything was good. Um, we wore our masks in, and I know masking was required then in that venue,
Mhm.
unless you were, eating or drinking at your seat. But as soon as people got to their seats, I noticed there was a much more relaxed kind of, people were taking their masks off. Um, I can't even remember if we took our masks off to do a selfie to say where we were, or whatever. I don't recall
Mhm.
that. But I do know that we did have our masks on there. And if I were just to still go into the MVP arena again to enjoy a concert or again, I'm going to wear my mask.
Mhm.
That's just what I think is what I believe is right for
Uh,
me.
So in Albany County as well as the state, maybe even the country, do
Mhm.
you think that if it persists the way it does right now, do you think that outdoor activities for the spring and summer will be curtailed?
No, I don't think, certainly not outdoor activities. I don't think, let me step back. I don't think anything is going to be curtailed, right? I think that when you're already in a high area and there's already an advisory out about what best practice is, if people are following that, they're following it. If they're not, they're not. I think the one thing that people don't think about is when we're reporting, let's say, for example, today, we had 131 positive cases, new cases. That's coming off of, days where we had 200, 223, 213, 231, 213. I mean, a couple of hundred each day. And we're not reporting daily now. As a matter of fact, we report twice a week. Um, I think that those numbers are underrepresentations of what's out there in the community. And I think that the biggest indicator is that if we're at a high risk and yet we have, one would say, only 131 today, it's because we're looking at other factors. We're looking at the home tests. People are
Right.
testing positive and they are not reporting that. So we don't even know what that exponential factor is of, is it twice as high, three times as high, five times? We don't even know what that factor would be, but we know it's a lot higher. And another indication that we know the numbers are high and are trending higher is the testing of wastewater. That's being done through the state and through some other partnerships there. And Albany County agreed that one of our wastewater facilities that represents about roughly 80,000 households, 80,000 in the city of
Okay.
Albany,
Okay.
would be tested. And we know that the numbers had been trending higher. So when wastewater is tested, it's an indication, it's like looking in a crystal ball to say what's going to happen in the near future. If
Right.
the wastewater is higher, that means that the numbers will get higher in the future. Um, it tends to show up in the elimination phase, and in the
Okay.
wastewater, the sewer water, before it manifests in our
Okay.
actual numbers.
But people have not been admitted to the hospital as much as they have had in the past, right?
Right, in the beginning, well, and I think there are very big reasons and good reasons why, although people that are going still being admitted, it's my understanding that more of them are not vaccinated, not completely vaccinated, or that a vaccination has expired, because we know that if someone got their first two shots, right, that would be last year. Chances are pretty good, depending on when you got your first series of shots, that has expired now, just like a flu shot would expires after a certain period of
Right.
time. Um, yeah, so people know that how to better treat this, and when they go into the hospital, or when they go in, they might not be admitted, because if they go into the hospital, there may be other ways to mitigate it, rather than actually admitting
Mhm.
someone who's serious enough to come into the hospital.
Yeah, but no matter how many times you're vaccinated, that's not going to curtail the variants. If the variants are going to
No.
be a variant, it's going to be that no matter how many times you're vaccinated, right?
Hmm. but but think of the positive in that is that you're not fighting something without any protection, right? So the
Uh-huh.
variant has something that's slightly different, and so the shot that you have gotten, the series that you have gotten, is going to protect you, one would think, from a majority of that, and your symptoms are may in fact be milder, and certainly may prevent death, hospitalization, and or death.
So, Mary, we're just about out of time, and I'm sure that we will talk again because this is not going to go away
Oh,
anytime soon. So, you've been listening to Focus on Albany. You've been listening and watching Mary Rozak. I'm Cynthia Pooler. This is Focus on Albany. And if you like this, please subscribe to my YouTube channel. Thank you. Have a great day.